Hello guys, it's Mary Dwin. I'm therapist and coach. And in this video, I'm going to talk to you a little bit about the type of trauma therapy that I do, which is called reintegrative therapy. And it is a therapy that is emotionally focused and uses an imagination and kind of a connection with your inner child or with a part of you that is dissociated from trauma, and through a mindful observation, mindful self-compassion and emotional self-compassion comes the healing and then reintegrating, which means like putting back together that split part of you, kind of embracing it inside you and healing the part of trauma. And I'm going to illustrate it on one case of one client. Of course, I'm not going to use the real name or anything that could be used to identify her, but with her consent, I'm doing this and using the case scenario to show you how that might look. So let's get into this. How does that kind of emotionally focused trauma therapy looks like? Of course, as every other therapy, there is first this stage where client comes, describes a problem, we talk, I'm trying to see the history of the client, the symptoms, the problems, what might be connected to what and all that, then exploring the coping mechanisms, how they can actually cope with stress to ensure that it's going to be safe, that they have enough mechanisms and enough strength to actually deal with the process and all of that, which is similar to other therapies. And then when we get to the core, it may look like something like this. So this client, she brought particular problem she has right now. Of course, she has many because we are working on a lot of things gradually, because she has a CPTSD, complex post-traumatic stress disorder, from a loads of abuse she's been through. But now she is already on a journey for quite a time, and now she brought a symptom that this week we had these team meetings, team buildings, and actually this happens to me all the time in this scenario, this, and she described a lot of these cases. But particularly this week, I couldn't sit next to a colleague. We were supposed to do some activity, some play, and I really couldn't do this. And I have this problem that I cannot stand to be next to men closely, even if it's friends, even if it's colleagues. I have a hard time to even hug them or to even come closer and sit closer or anything, basically to trust them in any way, and especially when it comes to anything closer and a physical intimacy and a physical closeness. We are going to look at now with how we work with this symptom. So, of course, we first talk about it a bit, how it looks in different scenario, and explore how she feels in these situations. And then we get into the protocol of the trauma therapy itself. And we start with, I would call her Karen, okay? So I would say to Karen, like, okay, tell me, look at the situation when it happened, like, for instance, last time this week or in this recent time in your life. And describing the situation, look at her from a third person's point of view and look her in the eye and try to connect to her and tell me, what do you see in her eyes? What do you feel that is happening there? And so she looks at it, she imagines herself, and she starts to describe me these feelings, like, for instance, well, I see that she feels very uncomfortable, she feels very threatened, she feels like she wants to hide, she wants to escape from there, she's not safe, she feels like almost guilty for being a woman, and she starts to describe me some feelings, and we go through the levels and layers. Of course, this happens very slow. I'm speaking fast now for the purpose of video, but in a session, the more you work with emotions, the slower you have to be. The voice has to be very calm and soothing. I am completely tuned. I'm opened. I am non-judgmental. I'm opened. I'm observing her. I'm feeling her. My empathy has to be 100% there. I'm basically watching what's happening. I'm there in the room, in my screen, in my imagination. I'm seeing what she is going through, and I am feeling it with her. And step by step, helping her to process it through questions, through listening, through active listening, through mirroring, and actually responding, basically whatever she tells me, I paraphrase and give her back, and try to make this dialogue so she knows that I'm there, she feels that I feel her, I see her, I understand, and it's like ongoing exchange of this slow emotional process of awareness, what's happening there, what emotions, what thoughts, what beliefs are present in the situation. And when we get to that level where it really hits the core and the layer of maybe the strongest emotion and also kind of a belief connected to that. So it might be in this case, I feel terror, I feel threatened, I feel so threatened, and I feel shame. And so we connect to that threatened and shame feeling together. I help her to do that. And then sometimes this happens spontaneously, immediately the client does it. Other times I need to lead the client to that. But then the original memory or original trauma comes to play. So I may say something like, now when you're connected to Karen, let your mind flow freely to the past and let it bring you the maybe earliest memory when this happened to Karen before. When did she feel like this before? But in the case of these clients, it came like this immediately, even without me asking. She says, oh, I see something. I'm already there. Something happened. So now we are going into the past, and we are going to touch that past self, that previous. Usually this is a child, not always. It can be also adult. But we are, in this case, touching a child that has been through some abuse. This is very sacred process, very sensitive. It requires a delicate presence and empathy and respect to the person, utmost acceptance and respect to whatever they are and they were going through. So it is, for me, a privilege that the people are actually letting me into their secret spaces, which they never let anybody in, even themselves. They were blocking it for years. And now I am just with them, accompanying them there. But the whole process is her to be connecting to little Karen, to being compassionate to her. And as this client is a Christian, a believer, she also wanted to God be present there, which is even more powerful. Of course, I do the therapy even with the people who are not believers, and that self-compassion still has a healing capacity. But my experience is that people who have God in the picture, or at least they feel that, okay, he is with me here, the love, his acceptance, his healing power is around me, it gives them safety, much more safety, and also a supernatural power and presence to actually access those parts and maybe go over the defense mechanisms much more easily. So in this case of this particular client, she wanted it, and she says, okay, let me first focus, I'm safe here with God, and then we can go there. Of course, one very important thing with these therapies is that you don't want the client to re-experience it all. You don't want them to go to this swirl of the trauma and be like sucked in. So we do a lot of grounding techniques. So we always go like as far as she can, and then whenever she starts to be like dizzy and losing herself and like kind of dissociating more, we would kind of pause it, and I would say, okay, come back, open your eyes, you're here with me, that's everything is fine, you're just looking at little Karen, it's not happening to you, it's not happening to you again. It's safe here, touch the ground, feel your legs on the ground, touch this fluffy pillow, like look at me, let me do some breathing exercises, and other, like there are some grounding techniques. And then we go back again, so that she's not re-traumatized. We want her to go there with safety and self-compassion. And so when she's looking at the little girl, and in this case, the memory was the little girl who was actually abused by her own father, uncle, and other friends of the father, and she was molested countless times throughout her young age and years. So we are looking together, and she's telling me, okay, Karen is in her house, little Karen, she's maybe 10 or 12, and she's in a house, in a kitchen, she's there with a father, and she's so scared, she's terrified, she's petrified, what's gonna happen? And she starts to tell me the feelings that she sees in Karen's eyes, and she is looking at her young self, and and we talk through that, and I give her a question, what's happening, what is she afraid of, what she feels, and all that dialogue is happening, and she's processing that pain and that actually sexual abuse that was going on, and not just once but countless times repeatedly over her life. And though it wasn't a rape, it was many abusive, molesting touches and bad words and filthy looks and proposals and uncles and friends, and almost like everybody was invited into this abusive treatment and complete breaking of the boundaries of intimacy, of body, of sexuality. And so she's telling me she feels scared, she feels frightened, she feels completely shameful, and she feels terribly guilty and hopeless because she cannot do anything about it. She's trying, but nobody's listening. She's crying for help, but nobody's there. And so we are in this deep moment. And then I invite her, when she's connecting to her, and to realize how she, an adult Karen, feels about this little Karen. What does she feel towards her? And I lead her to experience and to express this compassion that she has towards her, that love, and then how she feels sorry for her, and how she wants to help her, and she wants to save her, and she wants to tell her that it's not her fault, and all those things. So I lead her to actually express it to that little girl. So she gets into the picture, and she hugs her, and she's telling me that, okay, she's fast so scared, she doesn't even want to look me in the eye. And so we proceed very, very slowly, very carefully, very respectfully. We don't want to push anything that she's not ready for. But as we go, the little girl suddenly sees her, and she kind of allows herself to, she sees it's safe, so she hugs her back. And then she's telling her, the adult Karen is telling her whatever she has on her heart, that I'm so sorry this was happening, and he has no right to do that, and they have no right to do that, and you are mine, I'm going to protect you, you are beautiful, and you're pure, and this is not your fault. And all those things that she needed to hear, because actually Karen knows what little Karen needs. Most of the time the people know. Sometimes I offer them some suggestion that maybe she needs to hear this or that, but most of the time people, as they connect their young self with compassion, they somehow know, and they are giving this love and this comfort and this safety to the child, and the child starts to calm and starts to heal, of course there is crying, there are tears, and the pain and the stress is leaving the body, and even of course client reacts physically to it. Client is crying, client is sometimes shaking. There can be a physical reaction, but this all is actually resulting in releasing the pain and releasing the fear and releasing the lies that the child believed about themselves from this experience. And then the calmness and love and truth that what actually old Karen is telling to the little Karen are coming inside her heart, and she's hugging her, and she's literally telling me that I feel like she's coming into me. She's connected to me. She trusts me now, and she's smiling. She knows she's all right. And these things go on, and they have the follow-up, and there are many sessions that we solve different things. And of course, I am just showing you a small part of this, and I don't want to make it sound like I'm simplifying it too much. But on the other hand, these things are not that complicated in the true essence. The process is very delicate, and you need to know what you're doing. But the fact that there is love and compassion, and there is truth, and there is safety, and sometimes the clients need to express anger, and need to express that they are standing against the oppressor. They want to save the person, the child, or the past self from the situation. Other times it's more about what they tell her. Some other times it's some just like touch and physical experience that they give to the child. It depends. It's really I'm always like so open and oftentimes surprised that each person is different and what happens with each person, because I'm basically only guiding it and being there as a support and as a guide, but the client is doing that thing to themselves. And of course, as I said, with the people who are open to invite even presence of God there, usually these things happen much faster, and they even feel and see how He is there, or how Jesus is there, and loving them and crying with them and showing them empathy. So it's even them and also He showing empathy and taking the child away, or doing something to protect them, and showing that this was breaking His heart and that this is something that He never ever wanted. And so they receive even deeper, often even deeper deliverance and deeper healing and deeper truth that is, I can't say it differently than it's like a supernatural moment. Sometimes in the room I'm like just almost, I can't breathe what's happening in front of me, and I feel this. I usually like pray in my heart. I mean, when things happen, I have this my kind of inner dialogue where I invite Holy Spirit's presence into the process. Of course, I don't say that to clients because I do therapy, and this is something that is like on the back of my being, because it's with me, and I just sometimes I ask Him, what shall I ask, or what should I maybe say right now? So I use my intuition also, and it's amazing to see what can happen, and how at the end client is leaving like smiling and like, wow, I never thought this was possible. I never thought this I could be free from this. I could be feeling so good, and then they tell me like later on how the situation changed in their life, how the reactions change, and so on. So I wanted to give you an example and encourage you that there is help, and there are many people and many therapists that actually can help you, or sometimes it's prayers and people who have compassion and are good at listening to what God wants to do with you also can do a big work and help you a lot. So there are loads of different ways, and I'm going to talk more in this channel about certain experiences that I've been through myself, and my clients are going through with me now. And yeah, that's all. I just wanted to encourage you and give you a little bit of a glimpse of insight on what even you can do with yourself when you are with yourself, because the self-compassion and self-love starts when you are with yourself. And even when you pray, the prayer doesn't have to be just asking something, but it can be inviting God into this process of opening heart and be there and experience His compassion towards you and bring you a healing and wholesomeness. So I wish you a beautiful week, and see you in my next video. If you like this and if you want to see more videos like this, please subscribe to my channel, like, comment on what you want to hear, and share these and help me grow this channel so other people might see it too.